Today we are just talking about pelvic girdle pain and lower back pain that lots of women may experience during pregnancy. That within our team there are lots of specialist physios who are able to try and treat your symptoms, and we can look at trying to help you through your stages of pregnancy. So as well as looking at your posture in standing, we also need to be very aware of our posture in sitting, because lots of people will spend a long time sitting, especially if you're working in a desk-based environment. So making sure again that we're trying to maintain those natural curves. So what can be really helpful is actually using something like a rolled up towel, or you can get really small little cushions, and you can pop those in the lower part of your back just to give you that little bit of extra support, so that you can sit up nice and tall and then work at your desk. Okay, making sure that everything is sat nicely in front of you, you've got everything to reach, easy reach, rather than having to twist lots and overstretch and then having to kind of adjust your posture. Making sure that you can keep that nice upright posture at the front, not hunching over a lot. If we remove this towel, you may find that you start to slump, which can be really quite uncomfortable and increase that load on your lower back, and also around the front can be quite uncomfortable. So really be aware of your posture, especially if you're sat for long periods of time during your day. But remember, keep getting up, keep moving around. You know, if you're on the phone quite a bit, can you stand up and answer phone calls? Can you just use that excuse, you've got a bladder that needs emptying a bit more regularly, can you keep going to the toilet so that you can keep getting up, keep moving around? Other things are, if your workplace has it available, can you get a workplace desk assessment? If not, and they don't offer it at your work, speak to us and we can talk you through that in a little bit more detail. But posture, because we do spend lots of time in sitting, is really important. The other thing is that when you're at home, the sofa may be quite uncomfortable because we tend to recline into it, we tend to slump quite a lot. If you do have one at home, what can be really helpful is actually getting the gym ball and sitting on the gym ball when you're at home, and you may find that's a lot more comfortable when you're sitting watching the TV of an evening. Or even, especially if you're home-based, can you sit on the gym ball for doing some of your work at your desk, or taking one into the office? So when you're in sitting, we've talked about our nice posture for sitting, sitting up nice and tall. We need to think about how we actually get up from a chair. Lots of ladies will have some discomfort and pain with actually getting up out of a chair. And we see lots of ladies starting to lead with their bubs and doing this and pushing on the chair. It's not great, okay? So we need to look at trying to adapt that position. So what we try and encourage ladies to do is to think about using the arms of the chair if they've got them. If you don't have them, at least putting your hands onto the sides of the chair, okay? What can be really helpful is bringing your bottom towards the front of the chair and keeping your feet tucked just underneath you. Think about squeezing your pelvic floor, and we'll talk about how to activate and squeeze your pelvic floor a little bit later on, but also squeezing your bottom muscles, because they're going to be really helpful to get you up. So using your hands, squeezing your muscles, then starting to bring yourself forwards and up you come. So the other posture that we tend to find we might be sitting in quite a bit is down on the floor. If your toddler is anything like my toddler, it's always mummy, sit floor, play with me. If you are getting down into this posture, it's really nice to have something to lean against. So sit with your legs out straight, leaning against the sofa, or another type of chair, or something a little bit more solid, so you've got that support. You're supported nice and upright from the back, and then your legs are out straight, keeping this symmetry. What we don't want to be doing is sitting with our legs crossed. You know, some women find this is fine, but actually can increase that pressure through the pelvis. That can be quite uncomfortable and cause you quite a bit of pain and discomfort. Maybe not straight away at the time, but later on. So sit with your legs out straight, and then play to the side with the toddler, or, you know, let them climb on you a little bit, but not too much. Once you're down in this position, you do need to think about how you're going to get back up again. Great if you've got something behind you, because you can use that to help you get up. So what you want to do is think about coming around onto your hands and knees, could be really helpful. So try and keep thinking about that symmetry again. Try not to move one leg more than the other. So coming round onto your hands and your knees, trying to keep that pelvis together. Then using whatever's in front of you to hold on to, and then pushing up from there, and then you're back in standing. So we're having to look at adapting the way we do things. Really kind of commonplace is we all use our cars, or we get in and out of different vehicles, and what we want to avoid is that asymmetrical movement again. So don't start to think about moving one leg and then the other. What we want to do is try and keep our legs together, so knees together, keeping your pelvis nice symmetrical position. And can be really helpful is to pop actually a plastic bag underneath your bottom, which can help with that movement. And what we want to do is bring our legs round together and then stand up out of the car in that position. Once you're out of the car, you need to think about getting back into the car if you're going on a return journey. So again, think about coming back down onto the seat, keeping the legs together, swinging yourself back round. If you've got that plastic bag underneath you, make sure you take it out for safety reasons. Lots of women find that actually having a bath can be really nice to help manage their symptoms, pain, or you just don't have a shower, so the bath is your only option. But getting into and out of a bath can be quite uncomfortable, can be quite difficult. If you've got someone around to help you, get them to help you, great, but they're not always going to be there. So rather than stepping into the bath and then stepping out, think about trying to sit on the edge of the bath, using your hands to help you, and then start to bring yourself around, popping one leg in and then the other one, okay? And then lower yourself down into the bath. When you come to get out, use your hands, really important to use your hands. Squeeze that pelvic floor, squeeze your bottom muscles, and what you can do is turn over onto your hands and knees and then come up again from that position. Bring yourself onto the edge of the bath and then out. So one area that we do day to day is getting dressed and undressed, and one of the things I talked about earlier, one of the common causes of symptoms, or something that can flare up your symptoms, is standing on one leg. So rather than hopping around your bedroom trying to put your trousers and your pants on, can we try and be a little bit more organised? Get all of your items of clothing that you want to wear that day together. Have a sit down, because in this position we're not then standing on one leg, we're not moving our pelvis into an asymmetrical position. Start off trying to leaning forwards, pop your pants on, then your trousers, okay, putting them on one leg at a time, and then once you're ready, have a stand up and pull those up. And then the same with shoes, thinking about, can we sit down when we do this? Can we try and avoid that hopping around trying to do things on one leg? Okay, and then sitting down, and you can dress your upper half as well from that position. We're going to just find that that creates much less pressure through that pelvis if we're doing it all in a seated position, and that we're trying to be a little bit more organised and avoid that standing on one leg. Something that really kind of causes them some discomfort or pain is actually going up and then downstairs. Can be quite a common cause of discomfort and pain for people. So our advice is to look at changing the way you actually go up and downstairs. So really normal is to go step, 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 and think about missing out a step. We need to take you backwards so that you're actually going to start going step, 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 so both feet land on each step, okay? So it goes step, 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 not step, step. With our steps, if you are finding that you do have one leg that is in more discomfort than the other, think about when you go upstairs, take your good leg, so the leg that doesn't have that pain, take that one up first, because that's going to help push your other leg up, and it's going to just feel a little bit more comfortable. When you're coming down the stairs, lead with that side that you find is a little bit more discomfort, so you come down with that leg that is in more pain. You're just going to find that probably makes life a little bit easier. Also make sure you use handrails if you've got your handrails, and squeeze your bottom muscles as well as you're going up, and as you're coming down. That can just help support that pelvic area. Quite common is that people say, oh, I've got a toddler, and they always want to be carried up and down stairs. As much as you can, try and avoid carrying little children up and down stairs, because it's just putting much more weight and load on your body. Really avoid ever carrying toddlers on your hip, okay, on one side, because that's going to load your one side more than the other. Going back to that asymmetrical idea, trying to keep your pelvis in symmetry. So if you do need to carry a little one, think about carrying them on the front. You lose your functional arm, but that's fine. You know, we need to look at keeping that pelvis in as much of a symmetrical position as possible. If little ones want cuddles, they want to be carried, as much as you can, think about actually sitting down and giving them a cuddle in sitting. They can come up to you, they can climb up to you, rather than you picking them up. The other thing is, if you are going to be going up and down stairs and, you know, try and encourage your toddler to kind of go up and down on their own, think about standing behind them when you're going up. Just, you're there for that safety aspect, you're making sure you're there to support them if they have any trouble. The other thing is, you may find that you want some kind of struggle with going up and down on your feet. Think about going upstairs on your hands and knees, and then coming down, sitting on your bottom and bottom shuffling down one step at a time. You may find that's a little bit easier than going up and down on your feet. Footwear is really vital, okay? So looking at what we're actually wearing on our feet. Great if you can get away with trainers, perfect. They've got lots of support, they're nicely cushioned, and they've got it's a closed shoe. If you work in an environment where, or you're spending a lot of time where you can't wear trainers, making sure that you're wearing something that's a closed shoe that's well supported is ideal. Trying to avoid high heels if you can. That can just put a lot more pressure and change the way that we're standing, change the way that we're doing things when we're moving around. The other thing is, you know, yes, avoid high heels, but also avoid shoes that have got no support whatsoever. So your ballet flats, they're really, really flat and they don't give any support to the foot. So try and avoid anything that is super flat, but also that it's got a really big heel on it. Looking at something that's got lots of nice cushioning and support. Moving into summer, we see lots of ladies wearing flip-flops. Actually, we want to try and avoid flip-flops because A, safety aspect, they don't always give us very much support, and we do find that people may start to trip and fall if they're wearing flip-flops. We want something that supports the foot, gives you lots of natural cushioning. Something like actually a Birkenstock, this is what I was wearing earlier. They've got lots of nice support within them, and the foot is really nicely supported, yet you're also getting that nice airflow because it's hot and feet get hot, feet get swollen. So if you can get something like a Birkenstock, if you're wanting to wear something like a flip-flop, that is much, much better. So important things to remember with footwear is choose something that's well cushioned, well supported. If you can choose a closed shoe, great, or looking at something like a Birkenstock for your summer wear. Pacing is a really, really important thing to be looking at, and lots of women struggle with this because you just want to do everything. You think, right, I'll just get on with it, I'll just finish this one thing, I'll just do all the housework. Actually, if you try and do everything all in one go, you're going to find that you get yourself really tired, that you start to get a little bit of muscle ache, like you would do normally if you did any activity for a long period of time, but you might find that that discomfort and pain comes on a little bit sooner in pregnancy. So what we need to try and do is cut things up into smaller chunks. So for example, if you need to do the housework, can you look at doing one room? I just need to do the hoovering, but I'd rather than do the whole house. Can I hoover the kitchen? I'll have a bit of a sit down, a rest, a cup of tea, and then look, okay, fine, I'll now do the living room. Or can you do it over the week? So you do one room per week. That way you're not going to be kind of tiring yourself out, you're not going to be overworking yourself, and you'll be able to manage a lot more without aggravating and flaring up your symptoms. So pacing is really, really important. But not only just pacing, can you get other people to help you? Because you're not the only one that can do all of these tasks. There are other people that can help. We talked a little bit about trying to pace your activity with cleaning if you can't get someone else to help you, but trying to avoid some of these things. Hoovers, going up and down the stairs with hoovers can become really heavy, quite an uncomfortable thing to do. So try not to carry hoovers up and down stairs. This also brings you much more onto one side. Can you look at avoiding some of these positions, because hoovering tends to be really rotational, okay? Can become really quite uncomfortable. Maybe again, not directly at that time, but a bit later on because of that effect it's going to have through your pelvis. So can we try and reduce that? Also with your shopping, again, that can be really quite heavy. It can be a really heavy task, especially if you're moving things into and out of your trolley. Can we look at, with heavy items, can we look at doing an online order so that You don't have to lift up all those heavy items and put them into the trolley and then bring them out again when you need to check out. Also, pushing a trolley, that can put a lot more pressure through your pelvis, through your lower back. That can become quite uncomfortable. If you do need to go to a shop, can you take someone with you? You know, can you take your partner with you if you've got a partner that can then do the pushing of the trolley for you? As I said, online orders are great, but it's not going to be great for everyday items that you just need a little bit of a top up. You know, take a small trolley then, okay? With your other types of shopping, can you just do things, you know, in a paced way? Can you go to a couple of shops, have a sit down, have a rest, have a break, then go and have a look in a couple of the other shops that you want to go and have a look in?